B-50 complex is a combination of B vitamins that are essential for maintaining good health. It is used to treat or prevent vitamin deficiency caused by poor diet, certain illnesses, alcoholism, or during pregnancy. B vitamins, such as thiamine, riboflavin, niacin/niacinamide, vitamin B6, vitamin B12, folic acid, and pantothenic acid, are important building blocks of the body. Some brands of B-50 complex also contain additional ingredients like vitamin C, vitamin E, biotin, or zinc. It is best to consult with your doctor or pharmacist if you have any questions about the specific ingredients in the brand you are using. B-50 complex can provide a range of benefits, including supporting energy production, promoting healthy skin, hair, and nails, and aiding in the metabolism of carbohydrates, fats, and proteins. The typical daily dosage is 1 tablet, but it is always best to follow the recommended dosage on the product label. It is generally recommended to take B-50 complex with a meal to help with absorption. When taking B-50 complex, it is typically recommended to take it by mouth once daily or as directed by your healthcare provider. Make sure to follow all the directions on the product package. If you have any questions, it's best to consult with your doctor or pharmacist. If the brand you are taking contains vitamin C, it's suggested to take the medication with a full glass of water, unless your doctor advises otherwise. If you are taking chewable tablets, be sure to chew the tablet thoroughly before swallowing. For extended-release capsules, swallow them whole and do not crush or chew them to avoid potential side effects. If you are taking a liquid product, use a medication measuring device to carefully measure the dose and do not use a household spoon. Some liquid products need to be shaken before each dose. Additionally, some products containing vitamin B12 need to be placed under the tongue and held there before swallowing. It's important to follow the label directions carefully to get the most benefit. To ensure you get the most benefit from B-50 complex, it's recommended to take it regularly at the same time each day. If you experience mild upset stomach or flushing, these effects are usually temporary and may go away as your body gets used to the B-50 complex. If these effects persist or worsen, it's important to consult your doctor or pharmacist. Your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using B-50 complex do not experience serious side effects. While a severe allergic reaction to this medication is rare, it's important to seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, it's crucial to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice or report side effects to Health Canada. Before taking B-50 complex, it's important to talk to your doctor or pharmacist if you have any allergies or certain health conditions. This product may contain inactive ingredients that could cause allergic reactions or other problems. If you have diabetes, liver problems, or a vitamin B12 deficiency, it's important to consult your doctor or pharmacist before using this product. Chewable tablets or liquid products may contain aspartame, so if you have phenylketonuria, PKU, or need to restrict your intake of aspartame, consult your doctor or pharmacist before using this drug. Liquid forms of this product may contain sugar and/or alcohol, so if you have diabetes, alcohol dependence, or liver disease, be sure to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to talk to your doctor before using this medication. This product is safe to take during pregnancy when used as directed, and maintaining adequate amounts of folic acid during pregnancy may prevent certain spinal cord birth defects. It's always best to consult your doctor or pharmacist for details. This product can pass into breast milk, so it's important to consult your doctor before breastfeeding, although there have been no reports of harm to nursing infants. It's important to be aware of potential drug interactions when taking B-50 complex. This can affect how your medications work and may increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with B-50 complex include L-tretamine, cisplatin, certain antibiotics like chloramphenicol, certain anti-seizure drugs like phenytoin, levodopa, and other vitamin/nutritional supplements. Additionally, B-50 complex may interfere with certain lab tests, such as urobilinogen and intrinsic factor antibodies, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this product. It's best to take B-50 complex as directed by your healthcare provider. The recommended daily dosage may vary, so it's important to follow their instructions. As for the optimal timing, it's generally best to take B-50 complex with a meal to help with absorption. Always consult with your healthcare provider for personalized recommendations. If someone has taken too much B-50 complex and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to act quickly in these situations to get the necessary help. Remember to take B-50 complex as directed by your doctor or healthcare provider. It is important to keep all medical and lab appointments while taking this medication. B-50 complex is not a substitute for a proper diet, so it's best to get your vitamins from healthy foods. B vitamins are naturally found in leafy greens, vegetables, meat, fish, poultry, and enriched breads/cereals. It's recommended to take B-50 complex at the same time each day to help you remember. The daily dosage will depend on your specific needs, so be sure to follow your healthcare provider's instructions. If you happen to miss a dose of B-50 complex, take it as soon as you remember. But if it's close to the next dose, just skip the missed one. Don't take double the dose to make up for it. It's important to stick to your regular schedule for taking this supplement. Be sure to follow the storage instructions on the package and ask your pharmacist if you have any questions. It's important to keep all medications out of reach of children and pets. Do not dispose of this product by flushing it down the toilet or pouring it down the drain unless instructed to do so. Make sure to properly discard the product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.